Time up. Member for Chuka Igambangombe. Patrick Mwiga.
Thank you, Mr. Speaker, sir. Mr. Speaker, I rise to support this report on the 23rd, 24th financial year budget estimate as tabled by the Budget and Appropriation Committee. Mr. Speaker, the Budget and Appropriation Committee report proposes to increase the allocation to health sector from shillings 140 billion to shillings 141 billion for the financial year 23-24. This support, Mr. Speaker, will build a progressive, responsive, and a sustainable healthcare system for accelerated attainment of the highest standards of health for Kenyans. Mr. Speaker, this will guarantee a healthy, productive, and globally competitive nation for sustainable economic growth and development. Mr. Speaker, in order to realize this, the committee remains committed to the actualization of UHC, that is universal health coverage, through implementation of the National Social Health Insurance Scheme. Mr. Speaker, we want to move NHIF from being an insurance scheme to a social scheme so that we can be able to cover all Kenyans under the UHC program. Mr. Speaker, the Committee on Health is focused on ensuring Kenyans access quality health services through consistent supply of health commodities. We have had issues at Kemsa, Mr. Speaker, and we are working on that. We have really worked on that to make sure commodities reach Kenyans, to enhance capacity for human resource for health, to provide integrated health information system and the social insurance to targeted vulnerable households. In an effort to change bias from curative to preventive and promotive health, the government is focused on strengthening primary health care through resourcing the primary health facilities, establishment of primary care networks, and strengthening community health services. This, Mr. Speaker, means we want to move this country more from concentrating on curative to preventive and promotive so that we can be able to save on the money that is spent on curing diseases that we can prevent, Mr. Speaker. It's this backdrop that the committee approved shillings 1 billion allocated to recruitment of 44,444 community health volunteers. We will steer the revitalization of primary health care in the country. Mr. Speaker, in establishing the community health networks, we need community health workers who will be looking at households, communities, so that we can be able to detect diseases and health problems in the community as they arise, Mr. Speaker. Mr. Speaker, the proposed budget for financial year 23-24 is prepared based on the better approach, that is a bottom-up economic transformation model for the Kenya Kwanza government that sets out the administration priority program, policies, reforms to be implemented attentive. The agenda is geared towards economic turnaround and inclusive growth and aim to increase investment in 5 sectors, Mr. Speaker. Mr. Speaker, it's this backdrop that the Committee on Health approved shillings 20 billion for the bottom-up economic transformation model that is directly linked to this model. This includes increasing accessibility to universal health coverage, local manufacturing of vaccines. Mr. Speaker, we realize that as a country 60 years after independence, we buy all our vaccines from outside, and Kenya has a capacity, Mr. Speaker, to produce these vaccines. So as a committee and as a ministry, we want to empower the Ministry of Health that Kenya can start producing their own vaccines and stop all these importations, Mr. Speaker. Mr. Speaker, we also want to digitalize the health records in this country completely so that we can be able to know our health status and the diseases to concentrate on and what causes what at which area, Mr. Speaker. Mr. Speaker, I beg to support this report, and on behalf of the Health Committee, I thank the Budget Committee. Thank you, Mr. Speaker.
Thank you. Nabi Nabwera.
Thank you, Mr. Speaker. Mr. Speaker, I would like to start by saying that having looked at the budget estimates, 2023-2024,